Good morning, family. How are you this morning? I hope you remained blessed while I was gone. But I hope that you are here and ready to learn more about your health and you. My name is Deb Nevels. I am Program Manager for Community Outreach and Engagement with the Medical College of Wisconsin Cancer Center. That's a mouthful. And today we are talking about risk revealed, your tools, tests, and timely action. This month is Breast Cancer Awareness Month. And with it being Breast Cancer Awareness Month, we want to focus on today, we're focusing on the risk that we have within our community. And when we look at this, what I want you to understand when you walk away or as you drive away and get out your car from listening to us today, that you understand what we mean by high risk, um, how you can be navigated into getting care if you don't have a medical home, and also understanding the importance of having the conversation with your doctor. My guest and I were just talking about sometimes we have diagnoses and we just take it and we're like, okay, fine. And then other times we have questions, but we're nervous about asking them. I can tell you, our doctors, all of the doctors, they want you to ask questions. They want you to be knowledgeable about your health. And one of the things that we promote is that you have to be able to participate in decision making around your health. And that is extremely important when we talk about breast health. And I do want to note, because this always comes up, yes, men can also get breast cancer, but it does not happen as often. It is not as prevalent in men. However, because of that, men often gets missed or misdiagnosed. And just as women need to check their breasts, we want men to check theirs and also to check their bodies in general. Everybody should be aware of what their body is telling them because your body will let you know when things aren't right. Um, so, what we want to do is give you some really clear reminders, some facts. We're going to do some myth busting today. And we want you to be able to move forward without barriers. That is one of the key reasons why we have the show. So I am truly blessed today to have some beautiful sisters with me um, from Progressive Community Health Center. And I'm going to allow them to introduce themselves. Just let's start with you. Yes.
You would. I'm Jessica Barrera. You got to roll the Mars.
Yes, roll the R's. I
I'm a
cannot do
community.
that. That's why I didn't even try. That's why I didn't even try.
I'm
Yes.
a community health worker at Progressive Community Health Center.
Awesome. Awesome. Man,
And my name is Lisa Brooks. I am also a community health worker at Progressive Community Health Center. Good morning, family.
Good morning.
good morning. Now I'm gonna move a little bit different. So I gave them an outline, but you know me, family. You know how this goes. Um, Progressive Community Health Center.
Yes.
This is one of the things that we talk about with having a medical home. It's located in the community. What's the street? 35th.
3522 West Lisbon Avenue.
Yeah, 35th and Lisbon. Um, Recently, well, to me, it seems recent because I remember the old building,
Oh,
but
yes.
they've renovated, they've expanded. It's
Yes.
beautiful, but it's right on bus lines.
Yes.
So, what we want you to know, family, is that it's important to have a medical home.
Yes.
And if you can get to 35th and Lisbon, you can get to a medical home.
Yes.
You can get to a clinic, a community health center that can provide care for you. And these young ladies are going to be able to talk to you a little bit about the added benefit of coming to what we call a federally qualified health center or an FQHC. Um, but in the sense that there is, uh, okay, I'm trying to use this word in the right way. It's wraparound services in the sense of being able to treat the whole person, not just that you come in because you are concerned about your health, but there may be other resources that can also be provided. And within FQHC, being able to have those services in one place is so critical. Being able to have one person you can contact and they can say, oh, I know how to help you.
Mhm.
That's one thing that's so important with our FQHCs. And even though I work at the medical college, our relationship with Progressive is extremely important because of you fill in that gap sometimes that we aren't able to, and community will come to you
Yes.
before they will come way out where our main campus is located or any of our satellite sites
Yes.
because you're right around the corner.
Yes.
You're right in the neighborhood,
Yes.
which is so
Yes.
critical. So
Yes.
critical. So can you talk a little bit? Yeah, I'm throwing it at you. Can we
Okay.
talk a little bit about the services that are offered at Progressive?
So at Progressive, we offer not only the primary care, but we offer dental, we offer pediatrics, we have a behavioral health, we have a foot center, and a diabetic center of health. So we try to offer all of the services that are needed, where you don't have to leave your community to go to a hospital or a doctor. Now we also have locations at Hillside and an urgent care that is right inside of Sinai. So instead of you getting that big bill when you go to the emergency room, some things you can go to urgent care for
Hmm.
and you don't
Hmm.
get that big bill with that. So we try to offer all of the services where, like you said, we wrap around you to give you the care and service that you need.
Yeah, definitely. Just anything to add that's
You can talk about the walking.
Oh, yes, we do have the walk-in clinic that's located on the lower level on 35th.
oh, okay.
And which part of your
So
service has dental?
Oh, yeah, we have emergency dental there as well.
okay.
It's on a first come, first serve and walk-in pediatric services as well.
Mhm.
Wow. So that really is one stop. So one of the things that we say, because I can remember in the day, I'm not going to date myself, but I can remember when when I was working prior to coming to the medical college years ago, that we found when we looked at utilization patterns of our community, many people were going to the emergency room for things that easily could have been treated through an urgent care
Mhm.
or by contacting your doctor and just saying, my child has is grabbing at their ears. I don't know what
Yes.
to do.
Yes.
And the doctor, because they know you, they would say, I know my doctor would do this. Deb, your daughter always gets these ear infections.
Mhm.
Prescriptions on deck. Let's go ahead. But I wanted to see her in 2 or 3 days. Make that appointment ahead of
Right.
time. But it's important to have all of that right there for you.
Yes.
It's
Yes. So
mhm.
while mom's in getting care, you can have the children get care as well. Dentistry, you can get the children, mom, the entire family, and that's what it's about: a family serving a family
Right.
right there in the community. We look like you, we talk like you, we understand you
Yeah.
for what all intents and
Hmm.
purposes. We understand what you're going through. So when you're talking about something, we can relate, and then we can put it out there like, okay, so have you heard? And here, check this out.
Hmm.
So things like that, being able to relate and identify is really important when you're dealing with patients. So
Hmm.
that way they can understand and you can put it in terms where they are like, okay, yes, this is for me. I get what you're saying. Because some people go to the doctor and they don't understand the terminology,
Hmm.
the jargon that's being used, and they're afraid to say, well, what does that mean?
Yeah. Yeah. Yeah.
So we're letting them know you can say what it is to us.
Hmm.
Express yourself. We want to know
We want to know.
because the question you don't ask may be the very question that you needed to, or that could save you from some extra time in the hospital. So,
Definitely, definitely. And Lisa, I'm gonna go out on a limb and say that you might be bilingual, and that we all the language services are also available. So when you come to
yes.
come there, it's also if you have a if you have if one of the barriers which often happens is the language barrier,
Yes.
Progressive has those services also.
Yes.
We do have a lot of Hmong
Yeah.
Karen community Hmong speaking Karen speaking community that go there, Spanish
Okay.
speaking community that go.
Swahili.
Yes.
Swahili.
Yeah, so we
Oh.
serve a lot of different cultures. So when they come in, a lot of the time they just point at the language line tablet, and it's like,
Oh.
and we know, okay, we pull it up and let them choose which language,
Oh
and
wow.
we use the translator in order to communicate with them
Definitely.
what they're needing when they come.
Awesome. So this is part of the reason um, that we're talking about this right now because you all are based in the community.
Yes.
You know the heartbeat of the community, and you know the issues and concerns of the
Mhm.
community. And one of the reasons that there was a collaboration with the Medical College of Wisconsin specifically in the Cancer Center and the Community Outreach and Engagement, was that um, in identifying breast cancer risks and breast cancer diagnoses in the community, um, where you all sit is one of the places where we see high incidence.
Yes.
And that means that we see a lot of individuals who come through who are coming from that zip code,
Yes.
that community, that neighborhood
Yes.
that have breast cancer.
Yes.
And the hard part that we often deal with is that um, the diagnosis comes late.
Mm-hmm.
And we were talking about that's added into the risk level with all the other high risk
Mm-hmm.
pieces, because Black and brown communities get diagnosed at later stages, because I can totally attest to it. My mom was one. If the duct tape didn't work to hold her arm on, she would
Yes.
she I used to tell her that she would keep going until
Yeah.
there was no more
There was
go.
nothing. Yes.
And so if something was going on with her body, she didn't pay attention to it, because
Yes.
the children and my dad's
Mhm.
are the
We're
family health
busy.
came
We're too
first.
busy.
We're too busy.
Yeah.
We're too busy doing the things with the
We
stuff
got
with
a
the people
million things to do.
for everyone else.
Yes. Yes.
And so we often put our health
Yes.
on the back burner.
Yes.
And always last.
Mm-hmm.
And so this is one of the things that you all with this the collaborative work group, this is something that's really important, and I don't want to mess up anything, so I'm going to read. So forgive me, family. I'm about to read from this because it's a part of what Community Outreach and Engagement does, but it's a grant that was received through the Cancer Center, and it's a collaborative work group, which is part of the Community and Cancer Science Network. And the Community and Cancer Science Network actually brings researchers, clinicians like your docs and your nurses, your community health workers, your navigators, and community members to actually create together solutions that will last a long time, that will be impactful and will continue to be present to reduce cancer
Yes.
disparities. So we know in some communities we see higher rates, we see more people dying. So that's where we see the disparities, because there's a gap. And a lot of that gap happens because you look at communities and you can kind of cluster it and say it's all happening in this area.
Yes.
Um, the Milwaukee Collaborative Work Group, which is what you all are part of.
Yes. Yes.
Yay. The Milwaukee Collaborative Work Group actually identified that they wanted to work with Progressive Community Health Center because of your location,
Yes.
because of the way that you provide services in the community, and the fact that you are well respected in the community.
Yes.
And that you were going to be a partner to improve breast cancer outcomes, specifically in Black women.
Mm-hmm.
And I do want to say, and I'm going to slaughter these names. So family, you all know my friends at the medical college. I know who you are, but
Yes.
pronounce the names. But there are facilitators and evaluators, Kaylee Table and Jada Proctor, the collaborative work group members, Reed Cabrera, Dr. Chandler, Cortina, Estelle Cocroft, Freddie Deloney, Dr. Cortang, Dr. Jamila Cortang, Jenny Bohr, Jessica Martinez, Dr. Jess Olson, my girl, Minerva, love Minerva. Hey, Minerva, my mentor,
Miss Phyllis.
Miss Phyllis.
Miss Phyllis. Hey,
Miss Phyllis. Hey, Miss Phyllis. Miss Phyllis Holder,
Yes.
T. Marie Menifee Tribble. Did I say that right? Menifee Tribble, and Trina Ricks.
Yes.
And of course, you two. None of this could be done without Jess and Lisa. So the collaborative work group, what is it that you see is the importance of doing this work in the community?
Well, to save lives, first of all, we Black and brown women, for us to die from breast cancer when our counterparts live, that is inexcusable. That is like dying needlessly. So we're trying to prevent that. Let's cut that out. Let's debunk the myths. If you hear cancer, it's a death sentence. No, it's not. It means we got to fight like hell.
Thank
That's
you.
what that means. we finna fight. Let's put on
Mhm.
them boots. We finna box. We finna be Holyfield Tyson. All those. wrapped up into one. Let's fight.
Mhm.
And then to be there to give those resources to people. We had a couple that were diagnosed, a couple people.
Mm.
And I love talking about this young lady because she was hesitant to get her mammogram.
Mm.
And I was like, well, look, if you get your mammogram, don't worry about it. You're not going to be by yourself, whatever the outcome
Right.
is.
Right.
Lo and behold, it was stage 4 metastatic breast cancer. So she called me and she
Mm-mm.
said, well, it's stage 4. I said, okay, we need to get a game plan going.
Mhm.
And she said, what? I said, we need a game plan. We got to fight, right? And she said, yeah. She had the beautiful long dreadlocks, beautiful. And she said,
Mhm.
I'm going to cut them off. Why? We
Why?
don't know if they're going to fall out.
Mhm.
And she said, because it would kill my soul and would defeat me if her hair came out. And I'm like, okay. So I get her the resources, connect her to ABCD. So her next visit, she comes in. This is probably 2 months, 3 months later, and we're talking. So I didn't need to see her because she had gotten her mammogram, but
Mhm.
I'm going to check on you
Right.
because, hey, we're linked now. I told you you're not by yourself. I go
Mhm.
into the clinic and I said, well, how are things going? Her dreads were gone, and I'm like, you cut him off. She said, yeah, it was a choice I made because, again, it would take me from here to there. She said, I'm in fight mode, like you said.
Mhm.
I'm in fight mode. I'm going to live. And I'm like, yes. And I said, you got a mentor? She said, yeah. I said, who'd you get? She said, Miss Keisha. Now, Miss Keisha
Oh.
is the face of ABCD.
Yes.
And she said, I'm ready. I'm trying plant-based foods and this and that. I'm in my kitchen. So she was so excited. And I said, well, you sound like, we were thinking here at Progressive about doing a mentorship on survivorship. And I said, are you thinking about mentoring? She said, if they would have me. I said, I can punch out to go home, people. I was ready to go home because the job was done. But
Mhm.
she said they looked and she said the cancer they didn't see. She said, so I think we're in remission right now. She said, but you
Mm.
gave me the people who would help me pay rent, where I would get the food if the chemo was too bad, where I could go if I wanted to exercise. She said, you had a folder of stuff for me. I said, I told you you were not by yourself. I said, when you all come in here, you have to understand for this brief moment in time, you're family.
Mhm. Mhm.
So if I would take care of my family,
That part.
hello, family,
Yep.
I'm going to take care
I'm
of
gonna take care
you.
of you. Yes.
So I love telling that story because it gives hope
Mhm.
to the rest. So,
Correct.
and that's what it's all about, keeping that hope alive
Mhm.
because you're going to need it in your fight.
Right.
So don't let the diagnosis destroy you when you hear it. You just got to have the right people in line to say, okay, this is how we going to fight.
Mhm.
Okay, I got
Mhm.
this shield for you, that shield. I'm standing as backup.
Thank you.
So
Yep.
that's how we do it at Progressive. Your family, so we're gonna act like that.
And that's one thing that's so important. Just we were talking a little bit beforehand, before we got live. The resources that you talked about,
Yes.
the resources. So just you understand the, as we call it, the hierarchy of needs.
Mm-hmm.
What is most pressing and most important to them at the to your clients at the moment, to
Yes.
your family at the
Mm-hmm.
moment. So just can you speak a little bit about how you go about having that conversation to find out if there are resources needed?
I guess it's pretty much based on need, and each individual is different, and you can't just give them everything at once. It's like, okay, what is your immediate need? I need something to help pay my bills. I'm not going to be in working, so there we go, trying to find resources to help pay bills, financial
Mhm.
resources, or I need something to help pay rent. So okay, then each person is different. We have to individualize each resource to make sure, and they make that connection.
Mhm.
So here's the information. Do you want us to help you call, or is this something you feel like you can do on your own? And
Mhm.
majority of the time, like, you've helped me with this. I need additional. Okay, then. Or sometimes they feel empowered. They're like, I'm going to do this.
Mm-hmm.
This is me. I got this.
Mhm.
I'm like, if you got this, then we got you.
Yes.
Mhm. That's just beautiful, and understanding the differences and not coming with a cookie cutter answer. You
Yes.
can't. because it can be
Right.
overwhelming.
Yes, it
It
can.
can be that diagnosis. Go ahead, Jess.
Oh no, it's just when Lisa was talking about her patient made me think of mine.
Mm-hmm.
Because when they come in, first thing we do is my thing is I'm usually bubbly. I'm like, hi, I'm Jessica. Hi, I'm a
Yes.
community health worker. I work with this
Yes.
and this doctor, and they're like, oh Lord, another person's coming in. I'm
Yeah.
like,
And she's like she's a morning
Yes,
person.
she's a morning person.
Goodness.
Yes.
and I'm just like, hi, and I'm just like, uh, they saved the best for last, and they're like, oh Lord, what are you doing here? I'm like, I just got done with my doctor's appointment, but I said I'm here to help you schedule your mammogram, and then they're just like, I guess I go, and we provide. I go once you complete it, we do provide like an incentive. It's I
Mm-hmm.
call it a thank you for taking care of
Yes.
yourself.
Yep.
Yes.
And there was this one lady that I interacted with. Oh, such a lovely person. So she's like, I said, so if you happen to get your mammogram, we will provide you an incentive, a thank you for completing it. And she's like, I want my thank you. I said, okay. So we scheduled her.
Mm-hmm.
Turns out she went in, she ended up having a mass. It was malignant. Went back.
Define malignant.
It was cancerous.
Okay.
Mm-hmm.
So she had cancer. I was like, oh, she's like, she came in and she's like, it's all your fault. I was like, what did I do? She goes, it's all your fault because I came in to give her. She goes, they found something in there. And I was like, okay, so what's our next steps? What are we doing? So I did refer her to ABCD. I put the referral in.
Mm-hmm.
Mm-hmm.
Um, and then I gave her, she's like, you know what? I want to thank you. I was like, why? She's like, because if I hadn't gone, she goes, because it's been years since she's had a mammogram.
Mm-hmm.
She's like, I would have died. I was like, no, she had me crying. I was crying
Yeah.
at the end. When she left and she did her completed
Mm-hmm.
everything with
Mm-hmm.
her provider, I went into the room and I was like, because it's touchy, because it's like
Yes.
you don't know what impact you will have on a
That.
person.
Right.
Yes.
Yeah.
So, oh my
Yes.
gosh, you can make me cry now just thinking about it.
Yes.
But that's important. I mean, because you
Yes.
have to see your providers. And so
Mm-hmm.
community, I want to give you an opportunity to call into the number 414-444-5253 or 414-444-5250. And I want you to understand, and we'll talk on the other side a little bit about this. What you just described, that's a medical home.
Mm-hmm. Yes.
That's a medical home.
Yes.
So, family, when we come back on the other side, we'll delve into that a little bit deeper and also what this community work group stuff is all about. Thank you, and we'll see you on the other side. Good morning. Good morning. Welcome back, family. This is Deb Nevels with you again, talking about your health and you. And today we're talking about breast cancer risk. October is Breast Cancer Awareness Month. Hopefully, everyone is putting on their calendar or has already completed their mammograms. If not, now is the time to do it. I always tell people either schedule your mammograms around your birthday, so it's a birthday present to yourself, around Christmas, so that it's a Christmas present to yourself. But as long as you do it and make sure you get them scheduled. The other piece is have an accountability buddy. So have somebody to say, I'm going to get my mammogram. When are you getting yours? Let's ride together so then we can go to lunch afterwards, whatever it takes. Just making sure that you get this done. And that's what October does, is help us remind us around the importance of mammograms and getting breast cancer screenings. One of the things, I have questions for the community. We are talking this morning with collaborative work group members, Jesse and Lisa from Progressive Community Health Center, and they are part of a collaborative work group that's looking specifically at high risk breast cancer specifics, and specifically and getting people into care. But I want to ask the community. So think about this. How do you define high risk? What comes to your mind immediately when you think of being high risk? Um, and then for those that are joining us on YouTube, good morning, family. Appreciate you. Type in for us what you believe. One thing that makes getting your screenings hard for you or hard for family and friends. What are some of the barriers that they can identify? And if somebody in your family asked you, am I at high risk? How would you answer? What would you tell them? Family, you can call in. That number's 414-444-5253 or 414-444-5250. So, Justin, Lisa, let's talk. Jessica and Lisa, I'm sorry, I'm like changing your name every 3 seconds.
No,
Jess,
Jess,
Jess.
Jesse.
Okay, thank you. Thank you. Um, let's talk a little bit about what Progressive's work is with this collaborative work group. So, what is the purpose of the collaborative work group?
So the collaborative work group is a mixture of science, community, doctors, researchers, students, all working to work on how do we combat this issue of Black women, brown women dying from cancer, again, when our counterparts are living. So they take time out of their day to figure out what's the best use, or what model, what's the best practice, what practice do we need to create? And they use their specialties in order to do this. So this is a scientist and working behind the scenes, students at UW Ziegler creating flyers that are impactful, for you, that get your attention and says things that are relatable, to our community, not just some cookie cutter sheet they give you that fits all. No, you have to talk to our community about fear, because we have a historical fear when it comes to the medical community.
Mhm.
So this is some of the things that they help us work on. And Jesse and I take that back into the clinic, and we present this to the participants, the clients, and our patients.
Mm.
So this work group has so much knowledge and experience in figuring out. Some are in labs, some are working, talking about, discussing from a medical point. How do we keep these women healthy? Is it a nutritionalist? Is it the food? Is it the environment? What do we do? How do we do it? How do we help you? Tell us how to help your community.
Mm-hmm. And we actually have a caller on the line. Caller, good morning. Thank you for joining us.
Good
What
morning.
questions do you have for us, or statements?
Yes, the statement. Good morning.
Good morning.
Um, I'm a two-time cancer survivor. Of course, one being breast cancer, and 21 years ago I had lung cancer.
Mm.
But my question is, I had heard over the year, down through the years that cancer was hereditary and things of that nature. But I had not experienced anyone in my family having breast cancer.
Mm-hmm.
So when I got breast cancer, I'm going, okay, now I don't know if anyone, I didn't know this thing was it's not hereditary, I don't believe, because I was kind of like an isolated person that had breast cancer in my immediate family. It might have been somebody from many years ago, but
Mm-hmm.
I didn't know about that. So what I'm trying to find out is that something that can be hereditary that comes down through the family line, or how does that work? I'm cancer free now as for 6 years from breast cancer.
Woo!
Okay,
Yes.
congrats.
Congratulations,
Congratulations.
survivor
Oh
and
yes,
thriver.
Yep.
Yes, you are a
yes I
survivor and
am. Yes
thriver.
I am.
Yes.
And people use the terminology remission. But
Mm-hmm.
the God I serve, I serve Him through faith and my belief.
Yeah.
He deals in healing, not remission.
Come
That's
Thank
on,
how
the
you.
I
church is saying amen over here.
Amen.
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 you know.
Amen.
See, and when I think about me having breast cancer, and they caught it so early at stage 0.
Mm-hmm.
Mm.
I had
Yes.
a little nip and tuck in the left side, and they sent me home the same day. And I thank God for
Awesome.
that. But what my
Yes.
question is it hereditary, and can it be passed down through generations, the breast cancer?
So there are some cases where it is hereditary, and this is the importance of knowing your family history. We get together with Thanksgiving's coming up. This is a time where you ask questions, not just about eating the food and seeing folk, but it's about learning your family history. Because, like you said, it could have been someone down the line that has had this where we don't talk about it. It's kind of like the diabetes and the sugar thing. We used to hear,
Right.
"Oh, they got the sugar, the sugar." As a kid, I'm thinking, I want some sugar too. No, you don't. That's diabetes, girl. So, it's that it's taboo to talk about these things. Like, there's a shame factor. There's nothing wrong in being diagnosed. It's what you do with the diagnosis.
Right.
So yes, it could be hereditary. It could have been an environmental thing. It could have been something, it's everybody's body's different.
Mm-hmm.
But it could be hereditary. So if you're interested, I think the medical college does some hereditary, but depending on your insurance, it can be expensive. But yes, breast cancer can be hereditary. All cancers can be hereditary.
Yeah.
Oh,
And
okay. Okay. Well, I'm involved with Freighter. That's where my medical team is, and
awesome.
I do ask a lot of questions because I have health
Good.
Awesome.
challenges. I'm a diabetic and hypertensive, and all of those things I got. And I ask a lot of questions. But the cancer part that really interests me because I have two daughters,
Mm.
and
Hmm.
they have breast cancer in their side of the family, their father's side of the
Uh-huh.
Mm.
family. So I'm gathering information so I can pass it along to them as well.
Definitely, definitely.
Yes.
Thank you, caller, for bringing that up.
Thank you.
That is that is so true. One of the things I a while back we did a meeting, a conference on hereditary cancer, and it
Hmm.
was three sisters
Yes.
who actually
Yes.
their organization that they founded is called Families Fighting Hereditary Cancer,
Yes.
and they are, a couple of them are what we call previvors
Hmm.
because they looked at their genetic, they did their genetic testing, and like you said, depending upon your insurance, depending upon family history, it can be expensive.
Hmm.
One of the things, though, to note that I've been doing some research and reading because we're thinking about doing a project around this with another community health center, Health Connections,
Hmm.
is looking at um, prostate cancer. So recent research has found that for men who have prostate cancer, it puts their daughters at higher risk for breast cancer. There's a relationship between prostate cancer and the BRCA gene,
Oh,
which you
Okay.
okay.
often
Yeah.
hear about when,
Hmm.
yeah.
Hmm.
So there's a relationship between that. And so one of the things you said,
Hmm.
and the caller, I hope that you take your holidays and do this. It sounds like you're working with your daughters and everything, and they know this. But it's important that as we get around family, that we sit down, we look at our family tree. We know
Yes.
second, third, fourth cousin, what grandma and grandpa and our great uncles and all that. But do you know their health history?
Right.
Do you know, if um if like my grandmother passed away, I know that she had a heart attack,
Hmm.
but beyond that, I don't know anything about her health history.
Exactly.
I know nothing about her health history. Um, but it's like, how do you trace that back
Mhm.
without about asking questions? And I have to say, I know, like I tried asking my grandmother about
Mhm.
her health history,
Mhm.
and she was like, that's not your business. Stay in child's place.
Mhm.
Yeah.
Mhm.
Yeah.
And see, we have to explain that to our family the importance of this, knowing the family history, and it is so important because it may be a time where it's an organ involved, blood involved, where you could be the life support for that family member before someone outside of
Mhm.
your family is.
Mhm.
So we have to ask those, I'm going to say, tough questions. My family, we're pretty vocal, so it's like, Ma, what you say Auntie died from? Y'all say this, but what else? Didn't she have something? And it's like, oh yeah. And you get that oh yeah
Yep.
type
Yep.
thing. So you want to spend your holiday, asking the tough questions. It may not even be for you. It may be for another family member
Mhm.
down the road. So we have to stop making things taboo
Yeah.
and keeping our medical history secret. There is no shame in having a illness.
Mm-mm.
There is no
Mm-mm.
shame in that. The more people know, they become what we call support
Yeah.
systems. So if we take the shame out of it, we can get a bigger support system. So we have to look at that.
And by sharing that information, understanding that you are giving your siblings, your children, their children,
Yes.
your grandkids, you're giving them the information so that they can take that to the doctor.
Mm-hmm.
One thing about cancer screenings and breast cancer screening, mammograms are included in this.
Mm-hmm.
We have an age. So what's the age that people are told to begin their screenings?
Oh, 40.
So
40,
40.
40 and above for women for the mammograms. And then they do, I want to say it's the Gale, which is what they answer at the doctors. It's from
Mhm.
35 through 39.
Yeah.
And then for just doing self breast exams, I think the required age is 25.
Yeah.
Yeah. Yeah. So there's guidelines. I heard somebody I was at a meeting yesterday, and one of my friends, she was saying, it's a guideline.
Mm-hmm.
So let's think about this as a recipe.
Mm-hmm.
You have a recipe that
Yes.
gives you a guideline
Yes.
of what to add, when to add it, how much to add. But all of us who cook,
Mm-hmm.
we know we might add a little something here,
Yes.
add a little something there, but it depends upon your taste.
Yes.
So let's translate that over to your health.
Yes.
There is a guideline that you begin your mammograms at 40.
Mm-hmm.
But if you know that your aunt, your mom, your sister were diagnosed at age 40,
Mm-hmm.
the guideline shifts
Yes.
10 years back.
Yes.
So that means if you know that your mom had breast cancer and it was diagnosed at age 40, you should actually start your mammograms at age 30.
Yes.
And so what Jess was mentioned about the Gale, that's kind of the questions. However, if my mom never told me,
Well, you don't know, you
Yes.
don't know.
you don't know.
And then especially if you aren't doing your self checks
Yes.
every month. And that's why that's so important, because if you're not sharing the history in your family, you're working blind.
Hmm.
So those
And
self
so is your
checks,
doctor.
yes, and
So
your
is your doctor.
doctor as well. So you have to. It's an investment. Let's talk like we're talking money. It's an investment in you being
Hmm.
here.
In
And if you're
yourself.
not gonna be here for you, at least be here for your children
And those grandkids.
and the
Mm.
grandkids, because I tell some of the women that are hesitant when they're like, well, Miss Lisa, this and that. Listen, let's say, God forbid, something happens to you. Which one of those children is jumping in the coffin with you? And they have a response. Oh, that's Michael, girl. Quit saying Michael. Keep Michael out the coffin.
Yeah,
So
you don't
and
want
we
them.
have
Yeah.
to do this in order for us to understand this is very important.
Mhm.
This is a life keeping life type thing. So we have to talk about it. We have to
Mhm.
be about it. We just can't sit by and say, well, if it happens, no,
No.
you can do something
Please
about
don't.
it.
Yeah. Yeah.
Yes.
Yeah. I can remember having conversations with friends and I was like, well, God'll let me know, and God'll, yes, he will. But God has also
Yes.
blessed our doctors.
Yes.
God has blessed our outreach workers, our community health workers, everyone else. God has blessed all of us with individuals
Yeah.
who can walk with you
Yeah. That part.
if they know.
That part. If they know.
If they know.
Hmm.
It's so important. So I want to getting back to community work group and family again. Please feel free to call in 414-444-5250 or 414-444-5253. With the community work group and the work that you all are doing, um, how important is the engagement, the community engagement that you're doing?
Sorry.
Come on, Jess, you guys.
You made me draw a blank right now. Like put you on the spot. I'm like, oh Lord.
You got this. This is what you do
How
every
important?
day.
How important? It's extremely important because you're touching people's lives. It's like, okay, so we, how they call it, boots on the ground.
Hmm.
And then we kind of report back to the group, like, this is what happened. This is an individual that we've outreach to, and they like to hear the success stories because it's like, okay, this is working. What we put in place, what we're trying to accomplish, it's happening. It's
Mhm.
working.
Mhm.
And in seeing that, okay, so again, how Lisa was talking about, like the researchers, they're on the, I'm not like the hierarchy. It's like, okay, they're up here in a sense where it's like, okay, they're the medical brains, they're the researchers. Okay, we do this, we do that, and it kind of trickles down. But me and Lisa are the ones that are talking to the people.
Mhm.
We're there with them. We're experiencing what they're experiencing, and then we take that back to the group and be like, look, this is what we've done. This is what we've impacted. I think we provide numbers, like we've helped schedule, like
Mhm.
I think as of today, we've scheduled helped schedule over 100 mammograms.
Wow.
Yeah.
That's incredible.
So
That's cool.
they take that information, like, okay, so what we research, what we've done is helping
Mhm.
these women,
Mhm.
these people.
And they also want to hear what does not work.
Yes.
What
Oh yes.
the
Oh my God. Yes.
yeah. What the
What we've tried, what we haven't tried,
yes.
what we can improve on. Because
Yes.
Lord knows we've tried that with the at the clinic. Like me, like again, the program that we have, the grant that we're under, it's new.
Yeah.
So we played around with certain things. I know
Mhm.
I've like I said, like I told you, my inner nerd likes to come out. So I'm like, okay, we do this. And then so it's like, okay, we've tried this, but it didn't work this month. Let's
Mhm.
try something new.
Yeah.
Mhm.
We tried this month, it didn't work.
Yeah.
So far, what we have right now in place is somewhat is working.
It's working.
Yeah.
But there's
Okay.
always room for improvement.
Yes.
Mhm.
And it's watching those, looking for trends.
Mhm.
You know, we're seeing a lot of, okay, people needing resources for this or, you know, needing other things. It's
Mhm.
like, okay, group, they're asking for this. Who does this? And oh, no one does it. So how do we create that?
Mhm.
Mhm.
And they're there to help us create whatever it is that the patients are needing. So it has a lot of watching trends, looking at the numbers, seeing these patients as individuals, and then in a group, like out of this, you know, Mary, we got that, you know, Mary, we were talking to Mary and Susan, and then here's Mary and Susan in a group. It's like, how many of these people either like this or didn't like that? So you
Mhm.
have to listen, be an active listener, be very visual, you know, looking at things and understanding from their point of view. Because once they go home, they're not with us. And we can't say, well, maybe you should, maybe you shouldn't.
Mhm.
Things like food, like wanting to know what to eat. You know, that is something they share. Do we have to do just plant based? No, you can add
Mhm.
more colors to your rainbow. Fruits and vegetables. And then knowing them well enough to say, but if you're diabetic, watch the fruit,
Right. Right.
do more
Yeah.
vegetables. So it's learning them and then taking that information back, the trends, things we're seeing, to the work group, and have the work group work on some things. We work on some things and take it back to the patients for their determination. Like, yeah, this is great, or no, Lisa, that's not what we were thinking about. Like, no, that's not what I said. I
Wasn't
didn't
the
want
intent.
that.
Was not.
Yeah.
Well, and I want to. So what you all are describing, to quote Dr. Melinda Stolley, who
Oh,
is
I love her.
one of the leads of this grant, and she didn't. I don't think she put her name in that list. So
She
Dr.
did.
Melinda Stolley,
Yes.
you getting your credit. We're giving you your
Yes, yes,
roses.
Dr. Staley.
Um, but Dr. Stolle calls this an interdisciplinary team.
Yes.
So the interdisciplinary team, it actually begins with the patients.
Yes.
They are in the center of
Yes.
everything that's done in an interdisciplinary
Yes.
team.
Mhm.
And then you branch out.
Yes.
So you start with the patient, which you all have the
Yes.
connection to,
Mhm.
boots on the ground, if you
Yes.
will.
Mhm.
You take the patient's feedback
Yes.
of the patient saying, no, I don't like this.
Mhm.
They don't realize they're part of the research study
Mhm.
now and part of the research evaluation part.
Yes.
So they're saying, this isn't working.
Mhm.
That isn't working. Then you all are taking it up to the researchers who are trying to figure out the next pieces.
Yes.
Um, and the fact that, as people are getting the, and one of the things I always tell people, um, people say, well, if you find it, if I go, they're gonna find something.
Mhm.
Well, if you don't go, they won't find anything,
Well,
and it could be worse.
I say they're right. They're going to find something.
Mhm.
Either that you're healthy,
Yep, yep,
or they're going to find that, oh, we have an issue.
yep.
So yes, they're going to find something.
Mhm.
So when they're thinking negative, we have to throw that spin out there and
Yes,
say, yes, they're going to find something,
yes,
that either you have an issue or you're healthy.
right,
So yes, they will
right.
find something. You're absolutely
You're right.
right.
You're right. Because and it's made for some people. It's been years, but then you all are
Yes.
able to take the information about the fears and concerns of the community
Mhm.
and bring it to the scientists to
Yes.
try to figure out, okay, how do we? And Dr. Stolle is
Awesome.
a psychologist. Yeah,
Yes,
psychologist. Yes,
psychologist.
I always
Mhm.
want to say psychotherapist. That was my mom, but she was a
Mhm.
psychologist.
Right.
She is a psychologist, and so she understands behavior
Mhm.
and how to respond to it.
Mhm.
So she's taking a lot of the things that she's doing and being able to translate it into effective programming.
Yes.
Ultimately, I wanted to get you all's feel on what you think. How can this impact policy?
Wow.
Policy or how we deliver care?
Well, I look at it like this. You have scientists, you have the professionals, the people, this whole team that have watched the numbers. And most policymakers run off those numbers
Hmm.
because they're
Hmm.
looking at, these could be constituents. They help me stay in my job.
Yep.
So as a policymaker, legislatures and all these other things, so they look at the numbers. And when we are out there, for instance, one of the topics, dense breast. That is a
Yep.
big topic.
Yes.
What do we do once they say you have dense breasts? Okay, what am I
Now
to do
what?
with that
Yeah.
information?
Yeah.
Is this
Yeah.
gonna? You're just saying I got dense breasts. Is it gonna turn into cancer? Is it gonna do anything? Should I be doing anything?
Right.
And
Right.
there's nothing.
Yeah. Yeah.
There should be more to that,
Yeah.
other than
Definitely.
telling me that I have it.
Hmm.
What am I supposed to do with the information?
Yes.
I think that makes more people nervous and scared, because now I got dense breasts. Now, with the stress of hearing you have dense breasts, that could potentially, the stress of worrying about it can put you back into that you could possibly get cancer because you're stressing out, which is
Hmm.
one of the things,
Hmm.
environmental things. You stressed out all the time.
Yeah. Yeah. And understanding the impact. I do. So I asked about the policy impact because I was just in Madison
Mm-hmm.
Wednesday.
Okay.
My days are blurring together. I was just in Madison Wednesday. And part of what we were talking to our senators and representatives about was a law called Gale's Law
Mm-hmm.
around dense breasts. And Gail, I was fortunate enough to know her before she passed, but she had dense breast tissue,
Mm-hmm.
and had to fight and advocate for herself, because sometimes when you have dense breast tissue, you qualify for something more than a mammogram. You actually have to get an MRI.
Yes, that diagnosis.
And so Gale's Law was pushing that the MRIs would be less expensive for people to get, because sometimes if you advocate for it and you say you want it, but the docs say that it's not medically necessary, you then have to pay out of pocket.
Yep. Mm-hmm.
And this could run tons and tons of money.
Yes.
So um, Gale's Law is something, and that was a patient using her voice.
Mm-hmm.
And this is one thing I want our community family out there, I want you all to know, your voice matters.
Yes.
Your voice matters. One legislator that we met with, Representative Goodwin's office, his staff said that our outreach, the phone calls, the letters made a difference.
Yes.
So your voice matters. And this wasn't researchers or scientists. There were a
Mhm.
few,
Just regular people.
just regular people
Mhm.
who had been impacted.
Mhm.
And for when it went up before committee, the person who spoke, because Gail's no longer here,
Mhm.
was her 25-year-old daughter
Mm.
who watched her mom go through
Impact. Mm.
so much
Mm.
after her diagnosis. Your voice matters.
Mhm.
So your voice, whether you're talking to a community health worker, whether you're talking to your doctor, or even you feel strong enough to put it in a letter,
Yes.
send an email, make a phone call,
Mhm.
makes a difference.
Yes.
And we don't know unless we hear.
Yes.
We don't know unless we hear. So
Yes.
the policy impact um, can be big. The policy impact can be big.
Yes.
The other piece is uh, community health workers,
Mhm.
a valuable part of our system
Yes.
and of our health system. And so we've now incorporated community health workers
Mhm.
because boots on the ground
Yes.
in the neighborhood.
Yes.
You know, people will talk to you before they'll talk to their doctor or
Yes.
nurse.
Yes.
Yeah.
Yes.
They will tell
Yes.
you things and you'll be like, I'm not
Like,
sure about that,
did
but
you share that?
yeah.
That's a lot of
Did you tell the
information. Well,
doctor?
thank
Yeah.
you.
Yeah.
Did you tell the
Thank you
doctor
for sharing.
that? Because the doctor needs to know
The
that.
doctor needs to know. Yeah,
Yeah.
let's make a phone call. Let's go
Yes.
figure it. But yeah, but they will talk to you and you can say, I really, really think
Mhm.
we need to make an appointment.
Yes.
Or yeah, this is or I had a friend of mine who was like, I need to tell you something, but I know you work with the cancer stuff and I know you are immediately gonna rush me somewhere, but I need you to know I'm having an odd discharge. I'm like, what's odd? And it was out of her breast
Mhm.
and it was brownish. And I was like, yeah, that's not normal.
Right.
That's at all, unless you're a
Right.
car and you're leaking oil or something.
Right.
This is not normal.
Yeah.
So,
Yeah. Yeah.
so Jermaine, I'm sorry, Jermaine. I just cracked up.
It's like, yeah, don't want to see that.
Don't want to see that. No. But to say it's not normal
Yeah.
is important. Is
Yeah.
important. So as we talk about these fears and talk about um, the role that community plays in the
Mhm.
work that we do,
Mhm.
on the other side, when we come back after a break, I want to talk a little bit more about the value of that voice
Yeah.
and why it's so important.
Yeah.
We'll see you on the other side, family. Family, thank you. We so glad y'all back with us because it was in the studio
I am.
here.
I'm really glad because y'all was lighting me up over here. The only one that was nice to me is Jessica thus far. Hi, Jessica. How are you?
Wait,
All right,
we'll
Jessica's
get
Oh,
her.
he
fine.
nice to
Oh, he's
Jessica.
nice to Jessica.
Wow.
Lord, it's
You were
coming. It's
right.
coming.
Right.
Oh
Give it
goodness,
5
yeah, Jessica.
minutes.
Barbera. Did I say it right? Barbera.
Brother Mars.
Sure.
There we go.
Oh,
Barbera.
too.
Barbera.
Debo.
Oh, wow.
Debo, he's multilingual. I
No.
know. There you
You sure you're not Mexican?
¿Cómo se llama
You
usted?
got a little Latin in you.
No comprende español, señorita.
He didn't get far in Spanish.
So that was it.
Don't let
right
him
there.
fool you. He
That's
didn't get
about
far.
it. That's about
Yeah,
it.
he
That's
didn't
about
get
it.
far.
That's about it. Oh
He
my
didn't get far.
goodness. Family, if y'all could be here,
Yes,
if y'all
yes,
could be here, family. If
Yeah.
but there's coming a time you'll hear about it. Y'all gonna be able to be in the audience live, But so we're talking today about the collaborative work group that's at Progressive Community Health Center, talking about breast cancer risk, navigating Black and brown women into mammograms in a model that we're hoping will be what I like to advocate for, systems change, that we are able to incorporate community health workers and navigators early on in the clinical visit so that we can talk to them. And we were talking offline a little bit about, people not saying things to their doctor, but they're saying it to you. Just why would I tell you as opposed to not telling my doctor?
You find something relatable, and sometimes they're too scared to tell their doctor.
This
Because again, it goes back to they're gonna find something.
mm,
I was like, Holly said it. They won't find anything if you don't go.
Yeah.
In a sense, because I know I had that fear, and I try to be as relatable as I can when I'm talking to patients. I was like, I know what you're talking about, because and every time I go, I'm like, okay, you got high blood pressure. I was like, see, if I didn't come, I wouldn't have high blood pressure. You have a form of arthritis in your spine. See, if I didn't come, you wouldn't find that. But I'm glad I went.
but I'm glad I went.
Yes, I'm glad I went, because now
Yes.
it's like how we were talking earlier about genetics and stuff like that. It's like knowing your history. I'm starting my own little book for my kids, because I have daughters, I have sons, and I have grandkids.
Mhm.
So you have to start. And then of course, coming from a Latino family, Mexican family, it's like we really don't talk about nothing. So you need to know. So, and then of course they wouldn't go to doctors. We'll vapor rub it at home. That was our thing. Everything was vapor rub.
Vapor rub. Oh,
Vicks cure all.
Yep.
Vicks is
Vicks a cure all.
Yes.
Growing up, it's like, okay, I have leg pains. Go lay
Vicks.
down, go Vicks. Go
Mhm.
Vicks you up. I have a
Chest
headache. Yeah, Vicks. It reminds me of the movie Windex.
yeah.
So
I think of that too. Yeah,
Yeah.
my
my big
Greek.
fat Greek wedding. Yes, it
Yeah.
reminds me. Windex. Use Windex. It'll take
Yeah.
out the pimple. It's just like,
Yeah, it's
so they
What?
don't
Yeah.
go. So when we've done community health, but when we actually at one point we were going into home visits, and they're like, I don't want to go to my doctor. Well, why? Because that was like a barrier. They wouldn't go. But what was the
Mhm.
barrier? Transportation, food, stuff like that. And another one was, I don't want to know.
Mhm.
But I'm like, okay, so let's schedule. What questions do you have to ask your doctor? Let's write those down.
Mhm.
And of course, we also understand doctors have certain limit time. They can't address everything at once.
Right.
Mhm.
So, what are the top two things that you want addressed?
Yeah.
Okay, I want to know this and I want to know that. Okay, so let's go. And then at that point in time, we were actually able to go into with them by their doctor. We asked them, do you want us to go with you to the doctor?
Mhm.
We'd go. And then just how I look at Lisa, sometimes I'm like, they would look at me that way.
Yeah.
Because it's a role flip. It's like, okay, they want to know this.
Yeah.
And then they're like, Jesse, what? I'm like, oh, she wants to know this.
Yeah.
Yeah.
Because at that point, when I was doing community health work on a different level,
Mhm.
it was, okay, I'm feeling this, or my leg or my knee. But at the clinic, it's just like, okay, how Lisa explained, I got the discharge, or they're scared.
Mhm.
Women are scared. I remember I interacted with somebody who felt something. They didn't know, and this, I think, I please don't want me. I'm not
No,
sure if
you're
this would have
good.
been her first mammogram or or she's had some,
Mhm.
but she was crying. And then I was like, I can understand what you're going through in a sense that when I was 37, I felt something because I got into the habit. I'm like, okay, you know what? I gotta take care of myself because I had my kids were younger at the time.
Yeah, yeah.
I was like, if I can't take care of me, who's gonna take care of them? So I'm like, okay, yeah, I can understand you. You feel something. You're gonna get scared. I go, but you have. They had their partner there. I was like, you have support here. I go, you have us here. We're here. I go, so don't be afraid to let things known. Tell
Mhm.
your provider.
Mhm.
Um, and there's times where there's like, are you feeling like when it comes to wanting to know like the diagnostic mammograms, which is like a more
MRIs.
Yeah, the
yes,
MRIs
More
compared
and
to the
stuff. Yeah.
detailed.
ultrasounds, more
Yeah.
detailed more
Mhm.
detailed mammogram instead of just putting your breast into the machine and them scanning
Mhm.
it. Um, and I explained to her, I go, this is what happened to me in my situation. I was like about 30 some odd years old. I go, my daughter was merely barely, my youngest was 4 years old. I go, and I felt something that wasn't there.
Mhm.
And I panicked and I didn't want to go to the doctor and I was afraid.
Mhm.
I go, but I sucked it up because I had 4 kids under the age of, I think my oldest at the time was 15.
Wow.
I go, so I had to take care of them. I go, but
Mhm.
it turns out it was cysts.
And that's to remove that fear and to
Yes.
have that
Yes.
knowledge is so critical.
Yes.
We have a caller on. I don't, and caller, please go right ahead. Welcome to the show. How can we help
Hello,
you?
family.
Good morning. Is Debo on there salsa dancing with you guys?
Yeah, they know. They
I heard
know.
him purring, and then earlier this week he said he was D'Angelo as a sex symbol, and then
Wow.
right I called him a symbol.
Yeah,
So
that's
is he
just
acting up in there?
yeah, he's just a symbol. Yeah.
See,
He's just a symbol.
he's just a symbol. This is why we need family. Because see, family hears things, and then you
Yes.
call in and help us out. Thank you,
Yes,
fam.
I just need
family.
y'all okay.
Yeah,
My
we good.
question is, I was with Ascension with United Healthcare, and I would get my mammograms every year in December. Do you all do mammograms? And sorry for being late, Lucy, if you answered the question
No,
already.
not at all.
No.
You're not a sorry person. No apologies.
That's
needed.
right. That's right. You're right, Miss Deborah.
Are you asking if we do mammograms at the clinic?
Yeah. So is this more of if you're already diagnosed, you come to you all to
Oh
get
no,
assistance?
oh no. They at some point in time they did do mammograms there at the clinic, but they don't do them anymore. So when we actually
Okay.
set those mammograms up, we set them up with the major hospitals, which is Ascension, Freighted, and Aurora.
Okay. So the show is about if you already had your mammogram and need additional support, come see you all.
No, 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 no.
No.
Oh,
So if you
You're
are,
okay. You're okay.
if you're a patient of Progressive, and you've whether you haven't had your mammogram, we can help you get that mammogram scheduled, and
And
we can.
if you don't have a medical home,
Yes.
you can come to
Okay.
Progressive, and they have.
Yes.
So it's starting not just mammograms. Your whole health
Yes.
is really important.
Yes.
And Jess and Lisa are working specifically on a project that works with breast health, but we want you to also be very aware of your whole health. So they have providers that can see you for something other than it's more what they do is more prevention overall.
Mm-hmm.
Okay. All
Yeah.
right. Well, I'll reach out to my primary care doctor and find a new home for my mammogram since
Awesome.
they're not
Yes.
picking up. But thank you. What triggered me to call was I heard her saying that she cried with a patient, and I felt that. So
Mm.
I just wanted to
Listen,
find out.
we'll take you at Progressive any day
Yes.
because we love
Progressive.
family. Yes, we're on 35th and Lisbon and also in
Okay.
Hillside. Yes, come. The more the
35th.
merrier.
Mhm.
That's us. You would become family. So that's what we do.
And you already family because you called
Yes,
to check
because you're
on
calling
us.
here. We
Yeah.
Checked on us to make
Yes.
sure Debo wasn't being mean.
Yes.
I
So
appreciate you. So
yes.
Thank you so much. Have a great weekend.
You
You
too.
too. Thank
Bye-bye.
you. Yeah, and that's the thing. It's having that and just you hit on it.
Yes.
And this is the thing that I love about community health workers. Um it's a matter of feeling it and understanding and being able to be in that place where you can hear
And we call it as community health workers. That's one of the skills, the interpersonal skill,
Yep.
the ability to build rapport, to
Mhm.
have that empathy,
Mhm.
and be supportive of people,
Mhm.
and then also to give the resources and also the support that people need.
Yep.
We have what's called that innate ability,
Yes, you do.
where it's ingrained in you. It's not something we learn out of a book, but this
Mhm.
is who we were before we became community health
Right,
workers.
right.
We just want to help.
Yep.
And that's that innate ability. We just want to help.
Yep.
So whatever the issue is that would have come to us, if they would have said we were talking about fingernails, we'd have been like, we're gonna be the best fingernail people in the universe because we're gonna make sure they colored, cut, clean. So that's the innate ability that CHWs have. And we just enjoy what we do. It's not a job to us
Mhm.
because this is an occupation where you get to love on people.
Yes. And
You
that's
just get to love on people.
and that's one thing I think with CHWs, many of the CHWs I've met, they live in the community they serve,
Yes, yes,
and they're familiar. They know how they're personable.
yes.
You forget that you're even talking to somebody who's not your friend, and oh, that's right,
Yes.
we're here for an appointment, right? Okay, so yeah, what I said I needed, and you can
Yes.
continue going on.
Yes.
I also want to touch on, um, and I can't just like I mean the fact that you feel what patients are you feel with the patient. You have to stay straight.
Mhm.
You
Oh
have to
yes.
stay
Mhm,
you have to stay focused. You want to go, girl, I know it's but no, you have to stay focused because on the other side of this is treatment,
Mhm.
resolution to the
Yes.
issue,
Yes.
and they can continue thriving with knowledge
Yes.
of what their health is, and there's nothing to fear after that.
Right.
Once you know, you can feel in a better space.
Yes.
And then we can go back to doing what we said beforehand, where we do all the things for everybody else.
Mhm.
We put ourselves last, but now we get into a mindset where we put ourselves first.
Mhm.
And we know, okay, if I go down, what's going to happen to everything
The
else?
house of cards will fall.
Mm.
It will fall. It will fall. I want to talk a little bit about uh, so in family again, please feel free to call in 414-444-5250 or 414-444-5253. We're about to have a pop quiz.
Mm.
Myth or fact?
Mm.
Myth or fact? Only people with symptoms should get screened.
That is a myth.
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 You should be doing those annuals anyway and your monthly checks as well
Mm.
because there's a whole year in
Mhm.
between your mammograms.
Mhm.
So if you find something, you want to find it quickly and doing your monthly checks, you may find something if
Yes.
there's something to be found
Definitely.
from year to year.
Yes.
So that's where those monthly checks come in. Some people are like, oh, y'all, oh, but listen, if you have your yearlies and the month after you have your mammogram, you find something, you don't wait 11 months
Nope.
and let it fester.
Mm-mm. No,
We need to
sorry.
get on
No.
that right away.
Right away. Right away. Myth or fact? A normal test once means I'm good for years.
Nope.
Mm.
Ooh, Jess, you were quick on that one.
I'm just speaking from experience.
Yeah.
Nope, no. So it does. You can't get it one time and be like, okay, I'm done. I'm good.
Mm-mm.
No,
Mm-mm.
it's an annual thing. It's not a for life. They would have like mammo for life.
No.
You good for life. No, that's not what they
That's
doing.
not
They're
what we
like,
do.
see you next year. That's what they say. See you
Mhm.
next
See you
year.
next year. All right, myth or fact? If cancer runs in my family, there is nothing I can do.
Oh,
There's
that's
a lot you can
There's a
do.
lot you can do.
Oh,
Your lifestyle, the way you eat, you could be checked on your regular basis.
Mhm.
What you're eating, exercising. Dr. Stanley, as we were talking about, create a total wellness. $8 will get you eight
8 sessions.
sessions.
Yeah.
And
A
then you
dollar
have
a session
a dollar
through
session.
MKE Rec.
Yes.
Oh, yes.
Total Wellness is
Yes.
MKE Rec.
Yes.
Yep.
And then the prostate for the men. So it's stuff that you can do that could help you through the process. So debunk the myths.
Debunk the myths.
Yes.
Debunk the myths. So talking a little bit about lifestyle
Yes.
and prevention.
Yes.
What do you all? I mean, can you talk to individuals about, or talk to us a little bit about things that you all suggest as community health workers? Now, you not clinical. You don't
Nope.
look. I tell people all the
Mm-mm.
time, no, not that. I can dial 911. That's
Yes.
about best what you want me to do.
Mhm.
Um, but things that you can do to help prevent. You talked about eating the rainbow. I love that.
Yes.
Eat the rainbow.
Yes. Eating the
And not talking
rainbow.
about Skittles.
And with, no,
Yeah,
we are
no, not
not
Skittles.
Skittles.
What's those
That is
gummies, those Skittle gummies
gummy
and all
bears.
that
Yeah,
stuff?
oh,
Yeah.
so good. But yeah, no, that's not what we're
Right.
talking about.
No, we're talking about the fruits and vegetables again. Um, exercise, that is also one. And then, your environment, smoking or being around smokers, I just quit smoking. So yes,
Yay!
yes.
Girl,
So
yes.
it's doing those things like that, having controlling the things that you can control
Yes.
and eating right. Listen, family, eat right and exercise. Doctors will tell you for a fever, for a cold, for diabetes, everything is eating right and
Right,
exercise.
right. Yeah.
So let's just get into the habit. We ain't telling y'all to go run no marathons,
No.
Mhm.
but we're just saying move.
Mm.
30
Move.
minutes a day.
Move.
Move. If
Little
it's nothing
changes.
but the
Yeah.
commercials while you're watching TV, jump up on the commercials and march in place. We're just saying
Something.
move. Do
Move.
something.
Yes.
Do something. So eating that rainbow, again, not Skittles, eating healthy, the fruits, vegetables, and things like that. That's
And
what
so
we're talking about.
yes, so when we definitely as we talk about eating the rainbow and making sure that you're healthy, part of what we also are stressing, I know my family always says, so what am I supposed to eat that's purple? Eggplant,
Oh.
beets.
Oh,
There's a lot of
yes.
stuff. I've seen stuff online where they can make like eggplant lasagna, and I
Yeah,
think
oh
I
my
tried
goodness,
Yes.
that
something.
is
That was
so good. It's so good. I've tried that.
Yes.
But
And
yeah,
yeah,
so
these are things.
eggplant, beets.
Yes.
I have
Mhm.
I just found out that I love like canned beets.
Okay, yeah, yeah.
When they put them in the jar and stuff. So that I love that. So exercise. One of the things we've gotten so used to, and COVID did this partially,
Uh-huh.
is we have the wonderful way of being able to meet virtually.
Yes.
However, I can attest to this because yesterday was one of those marathon days from 11 until about 4.
Mm-hmm.
I had back-to-back meetings.
Mm-hmm.
Luckily, I have a standing desk, so I
Okay.
can switch. Um, but most of the times, if I'm sitting at home, I don't have a standing desk, and I'm
Yeah.
sitting.
Yeah.
And so you have to force yourself to get up, not just to get up and go to the restroom, but you can on your watch or on your computer, you can put a timer on that you get up every 15 minutes.
Look, y'all can't see it, but I raised my hand. We have chair yoga,
Yes.
chair stretches. So even though you're sitting in the chair, you can do things, the stretches, knee raises from your chair. So it's a lot of different ways, turning your torso. It's a lot of different ways you could still move. And not have the standing desk, because a lot of people say it. We do a diabetes group, and they're like, "Well, I'll be at home, and no, you can still do leg raises. You can kick your legs out. You can get a couple cans, and you can do some curls, sitting right there in the chair." And they're like, "You gonna think of yes, ma'am. I'm gonna think of
I'm
a
gonna think
way
of everything.
to make sure that we can. Every time you tell me what you can't." I'm gonna try to figure out something where
How
you
you can.
So we take that T out of there and kick it across the street.
There you go.
So we can do we can. So
And
yes.
movement is so important. And things
Yes.
people we talk about the importance of mammograms.
Yes.
That's prevention.
Mhm.
Moving.
Yes.
That's prevention.
Yes.
There's things that you can do yourself.
Yes.
In addition to getting the preventative checkups,
Yes.
but also eating right.
Mm-hmm.
When you have that urge to pick up the Skittles,
Yes.
grab an apple instead.
Mm-hmm.
So do something. I find if I peel a grapefruit,
Yeah.
that's keeping my hands busy, and therefore I'm doing something else other than opening a bag of gummy bears.
Yes.
But it's making those small changes.
Yes.
And like you said, we're not saying everybody needs to eat plant-based.
Right.
We're not doing that.
No.
Not doing that. Yep. Awesome. All right. Well, we're going to take another break, family. And we're going to come back on the other side, going to continue to talk about prevention, but I want to go on to what is really paramount in the work that you all do, and that is communication and trust.
Yes.
The pieces that you put in place that is so critical. So family, on the other side, we're going to come back and talk a little bit about that. Good morning, family. Welcome back to Your Health and You. I have to thank our family for checking up on us because they know we in here with the wonderful
Yeah.
Mr. Debo and Mr.
Yes.
Jermaine.
Yes.
They were giving us a run for their money, but that's
Mm-hmm.
okay. That's okay. We know they got their screenings done and they're healthy. We know
Yes.
they got their screenings done. They doing what they need to do.
We
So
were
they can
doing fine. Lisa started all this stuff.
Well, it's necessary. Look, it's necessary.
Yeah, Lisa started all this stuff. I
y'all
knew
are
she was
fun.
gonna be trouble when I met her at Clinton Rose.
Yeah,
Yeah,
see, he knew. He knew. He
See?
knew.
See, and that's the thing. And this is how family does.
Yes.
This is how family does.
Yes.
I may fuss at you and talk about you, but I'm gonna be like, so
Yes.
do you need a ride to the doctor?
Right.
I
Exactly.
need to know. I need to know.
Exactly.
And
Exactly.
that's one of the things that I this is why community health workers are such an important part of our health system providers. They are so important because the way you can communicate, I always say you have that perfect fuss factor.
Mm-hmm. Mm-hmm.
You can fuss enough that I'm like, all right, fine, I'll do it. But you don't feel that you're yelling at me. But you can
Right.
fuss.
Right.
You'll make that phone call to be like, okay, so we scheduled that appointment and I need to make sure that you can make it. Did you
Mhm.
plan your ride? Do you have everything together? Um, it's that communication style
Yes.
that is so important. And I talked about earlier being bilingual and multilingual. However, there's also that ability. So we talked about doctors and I think it's part of how we hold them in such high esteem because
Yes.
of the amount of school they went through
Yes.
and the knowledge that they hold.
Yes.
But being able to talk to people
Mm-hmm.
is a gift.
Yes,
It's
it
a
is.
skill.
Yes, it
It's a skill. And not everyone that's not everybody's ministry.
is. No.
Um, so that's what we have many gifts.
Yes.
Many gifts. And so being able to communicate and talk to people, like you said, the doctor leaves and then
Yes.
then that's when you all find out everything and you can go back to the doctor and go,
Yes.
come on,
Yes.
there's some more stuff.
Yes.
That skill in communicating and building trust, how I know you said it's you were born with it.
Yes.
Y'all were born with it. This is what you normally did.
Yes.
But how do you let somebody know when they come into the clinic that you are that person that's going to be able to have that communication?
I think it's, people know, they feel like you can feel, we say you can sense bull crap, when it comes to you,
No.
walks up to you like, no.
Yeah, this ain't right. This ain't right.
And
Yeah.
You can
they
smell it.
genuine. And then the
Mhm.
way you come in the room
Mhm.
makes a difference as well. I come in and I tell people I'm your new best buddy. Hi, buddy. And they'll look like, what is this woman talking about? And it's like, I tell them what I'm there to do. And
Mhm.
then let them know the importance of it. We do education on the breast and what it should look like and what it should feel like and why these mammograms are so important.
Mhm.
It's to help you live.
Mhm.
And what you're doing is investing in your outcome.
Yes.
And the more you know, the more you help. That adage, what you don't know won't hurt you, that is a myth.
Myth.
What
Myth.
you
Myth.
don't know can hurt you if you're talking about a cancer.
Mhm.
So we're trying to help you extend your life. And I think they get that when we walk in.
Mhm.
After we get to discussing things with them and letting them know, like, they feel like we're family.
Mhm.
So, and once they feel we're family, what wouldn't you do for your family?
Right. Right.
What wouldn't you do for them? You're going to try to make sure they got everything they need. And that's the approach that we take. We even took some patient navigation classes to make sure that we were doing the right thing for these people. So we invested in some education in
Mhm.
order to make sure that we're properly educating.
Right.
Mm.
So,
Yep.
and I think they feel that, know that, and then they see us in the halls before their
Oh
appointment,
yes.
and we're good morning, be like, oh, that's the lady always saying good morning. Oh, that's the lady so they already know. Yeah, yeah.
Well,
It's
and
like,
that's and I will say one small correct. It's not these people, but it's our people.
yes,
It's our community.
yes,
It's what we do. You go that extra edge to get additional
yes,
education, additional training,
yes.
so that you know how to serve
Properly
and
take
relate
care
and
of them.
properly take care of people.
Yeah.
Mhm.
That you're up to date on all the resources.
Yes.
And that's so important. That's so important. Just you've talked a little bit about after the patient leaves
Oh.
and then you cry, and I'm not gonna let you forget that. And but I know it makes you relatable, and that's what's so important. And doing that builds trust.
Yes.
How do you see? And this is something I'm struggling with trying to measure, because the my nerd side and my research
Okay.
side, I'm like, I need to measure that the community is trusting us. We work for health systems, but I want to see trust. How do you see trust kind of show up in the work that you do?
Ooh,
Yeah, and this is
good
a pop
question.
quiz question. She had no idea I was going to ask it. So yeah.
I guess I see it when they come back and they're actually able to talk to me and they're like, I get a thank you, or they're telling me stuff more that, how can I say it without sounding a little off?
Mm-mm.
It's like, I get to know more about their body.
Mhm.
I'm
Mhm.
like, I'm not a medical professional, right?
Right.
I don't know why that's swollen, but let me get somebody
Right.
who can help
Exactly.
you.
Exactly.
I'm not a medical professional, but
Yeah.
you know what? That's a good question. Let me go find that out for
Yeah.
you.
Mhm.
Yeah.
Because I'm like, example, I had a lady call me. I helped her schedule her mammogram. I get a call, and it took me a while because I couldn't understand. She was speaking so fast. I'm like, oh,
Mhm.
you wanna hola?
Right.
Can I help you? But it was like, okay, but can I get your name? She called me for something completely different, nothing related to
Oh.
the mammograms or breast cancer screenings.
Mhm.
It was something about her cardiologist and her heart, and I'm like, you know what? I was like, and I explained to her, I'm not a medical professional, but you know what? Let me give this information to your doctor and have them call you.
Mhm.
So for me, that was okay. They were able to give me a call. They called me, my extension directly, to talk to me, and I was on the phone with her for about, I want to say 30
30
minutes just
minutes.
to
Ah,
get the
that's
information.
I
Because she
love
was
it.
like, I was like, oh my God, man, I'm so sorry. I'm like, hold on. And I'm like, can I get your name? Provided me her name. Okay. What is the best number I can reach you at, or the doctor can reach you at? I was like, okay, so it's this number, this, and this is what you're concerned about. She's like, yes. I was like, okay, I will give it to the provider. So for me, that's a
It's
trust
that.
that I built with that
Mhm.
individual person,
Yeah.
that they called me completely something separate and something
Yeah.
Yeah.
non-relatable. But you know what? I will have somebody call you. She's like,
Yeah.
okay,
Well, they know that you may not know the answer,
yes,
Right.
but you will be able to direct them in the right position, right
Yes. And if
place.
you're looking into it, they know they're going to be
They
taking
know,
care of
Yeah.
it.
right,
So,
right.
and that's the other part of that. If you're on the case, my questions will be answered. It may not be the answers I want,
Mhm.
but they'll be answered.
Mhm.
You've had them look up into it. Now I have the answers I need, and I know once I get the answer, if it's not what we were hoping for, you're gonna be working
You're
on
gonna be
it.
working.
So
Yeah.
that's
Yeah.
the other part when they come back to us. It's like with a different issue. It's like you're on the case, cool. So if something else is wrong, I know you're gonna figure out what I need.
Hmm.
And a lot of that is us looking at it from, if we got that diagnosis, what would we need?
oh yes,
So it's putting
Yeah.
ourselves in their shoes
Hmm.
so we can meet them where they're at.
Hmm.
Some of the resources they don't even know they need,
Hmm.
because
Hmm.
their mind is on, how do I move through this?
Yeah. Yeah.
And our mind is on, how do we help you move through this?
Hmm.
Here are some things that right now you're processing.
Hmm.
And while you're processing, we're doing legwork over
Right.
here.
Right.
So when you're done processing that, the diagnosis, we have some options for you. So here's some stuff. Okay, here's some things that people may need.
Hmm.
They may not, you may not need them, but here's information. What you don't need, let us know. But call us back and tell us, because I
Right.
know it's going to take you a minute
Right.
to fully process. When
What's
I
going
say
on?
process, hear the diagnosis
Right.
again,
Right.
feel the diagnosis to understand, some people get their cry out, and then
Hmm.
they're ready to fight.
Yeah.
So it's,
Yeah.
go ahead and process
Hmm.
and come on back. And
Hmm.
then we got your gloves ready. We got some extra ones. We got our combat boots too. We got your back. So you start out punching, we gonna come out kicking.
Right.
So we're gonna
Yeah.
do this together, in other words.
I had a patient. She said as the first caller said mentioned about her faith.
Yeah.
And I had a patient who said, you know, I don't have, why would I cry? Why would I be upset? God said. And I was, oh, we about to call. Okay, let's go there. Let's go. What we
Yeah,
doing?
let's do
She
it.
said, I'm about to call some friends, my prayer warriors. We
Hmm.
about to get in these closets, do these prayer, get into our prayer closet, and I'll be back tomorrow.
See,
And this is what I need. And sometimes you don't know what you don't know.
yes,
Dr. Pat
yes,
McManus, I love her.
yes.
This is what
Oh
she taught me.
yes,
She
I
taught me
love
you
her.
don't know what you don't know.
And it's funny after once I did, we had to do an internship, and I did mine with her.
Okay.
Yes, and I was like, this little woman, okay.
Feisty,
Yes,
just a taint.
yes,
Just
and
a
so
taint.
smart.
Brilliant. Yeah. Yeah.
Whoa, I was sitting in the
She,
meeting like a third of that went over my head, but I
but
got you
I
when you
got you.
they were talking. It was over my head, and then you brought it back like boom, and
Hmm.
that's what I meant.
Oh, that yeah.
I was
She's
like, okay,
that's the
shut it all
advocacy.
down.
That's the
Yes,
advocacy. But that's I mean, it's being able to expose ourselves to resources and community members and people. And the other thing, as Depot was teasing you about seeing you at Clinton Road, this is the thing, you will see us around.
yes,
I see you all around. You're in the
yes.
community. You're at doing outreach.
I'm at Clinton Rose at 1 o'clock today.
But 1 o'clock today, she's out there
Yeah.
working. You all hear that? You need her. She
Yes.
will be at Clinton Rose at 1 o'clock
1 o'clock
today.
at Clinton Rose,
1
y'all.
o'clock. So it's, I mean, but we go into the communities,
Yes,
and that's that trust factor. Because I saw
yes,
you over at Gauss. I
yes,
saw you. Yeah, I saw you over there. You were
yes,
at Juneteenth. I saw you there too. You
yes.
okay? So you might know a little something about something
Mm-hmm,
because I've seen you,
mm-hmm. Yes,
and so that's that other trust factor. But it's
yes,
still, I yeah, I'm still, my nerdy side is still like, I need numbers to
mm-hmm.
show the trust is increased. But the
Yeah, and
numbers are
yes.
just as you defined it,
Mm-hmm,
the callbacks,
mm-hmm, mm-hmm.
the telling you things that aren't even related
Oh yes.
to your job. That's, I tease all the time at church. They know I'm known as the cancer lady. And I've had men come up and explain things. I was like, where is your wife? I need to, where's
Right.
she go? Because I don't want to hear this part.
Yeah, yeah,
And
yeah,
I think you need to see a doctor for that. So
yeah.
yes. So as we talked about lifestyle and prevention,
Mhm.
getting moving, eating right.
Yeah.
You all can also make referrals to nutritionists. Is that what you have?
Yes, we can do a referral to nutritionalists.
Okay.
Um, yeah, you can do a referrals. Basically, anything that they need,
Hmm.
we can get the referrals for. So, some people may need a nutritionalist. There are like Dr. Tully's Total Wellness, where they do
Mm.
some food
They do food demos.
demonstrations,
Yeah. Hmm.
where you can learn about different foods.
And again, that's in the Milwaukee Rec.
Yep,
Good. The book's just, I think I just got my book not too long ago.
yeah,
You look in the book and you can see it's like $1 per week.
yes,
There's a program for men who are
prostate,
prostate cancer
yes,
survivors, and there's total wellness that's for women.
yeah,
Both of them equate to about $1 a week, I think, is what
yes,
it is to participate, which is
yes.
really, really inexpensive to learn about how you can prevent
Yes.
and have healthy lifestyle.
Yes.
Yes,
Yes.
yes.
So yeah, and then also another important part is the pharmacology part of it. The
Oh,
pharmacy, knowing what these drugs are and what the drugs do to your body, what to watch out for. Because you
hmm,
could be having a symptom like, oh, this is happening. I keep feeling like this. Know what these drugs are, and then the interactions with each other as well. If you have other drugs, like the caller earlier was like she has several different chronic conditions.
hmm,
Well, if you're taking medications for those, you need to at least do medrex with your doctor a couple times a year to make sure
hmm,
that you also have specialists. So
hmm.
everybody needs to know what they're giving you, so they don't interact and you're not taking two of the same type of pills
Right,
as
Yes.
well.
right,
So you have to
exactly.
look at pharmacology as well, nutrition. It sounds like a lot, but you're investing in yourself. You are worth it.
Right.
Mm.
Okay, we ain't
You
gonna let
worth
nobody
it.
tell you anything
Otherwise,
else.
nope.
You are worth it. You are worth the work that you put in to keep yourself healthy and for us to help keep you healthy. You are worth it to us, so we're gonna put in the work.
We're gonna put it in.
We put it
So y'all
in.
put it in.
Yes.
Well, as we come slowly, we're coming to a close of this program. I think there's a couple of things we want to make sure people a call to action.
Yes.
So call to action. Um, your breasts matter.
Yes.
Yes.
Your health matters.
Yes.
Your family is counting on you to be there.
Yes.
So it's important that you do these preventative measures to make sure you stay healthy.
Yes.
So I ask that you do some things just to take initial steps
Mhm.
to make sure that you stay healthy. First, find a medical home.
Yes.
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 Find a medical home. We've been talking to these young ladies from Progressive Community Health Center right on
Yes.
35th and Lisbon.
Yes.
There's and Miss Lisa's gonna be at Clinton Rose at 1 o'clock. 1 o'clock today. If you got more questions,
Yes.
you can walk into Clinton Rose. That's
Yes.
that's
Yes.
the community hub right
Yes,
there.
that's right.
But you have to find a medical home. Once you find that medical home, and this is part of this how we want to continue this program, sustaining the program.
Yes.
The need for community health workers is key.
Yes.
The role you all play is key.
Yes.
So when I talk about policy impact, systems change
Yes.
impact, having you in the health systems
Mhm.
as part of the care team is
Yes.
critical part of the work
Yes,
we
it
do.
is. Yes, it is.
So always look for your community health worker within the
Mhm.
system.
Yes.
Your nurse navigator, your
Mhm.
patient navigator, your
Mhm.
navigator, period, within the
Yes.
system.
Yes.
Um, and that's really, really important. We want you to ask the questions.
Yes.
Don't walk away from your doctor's office without having to ask questions. Any question unanswered is knowledge that you don't have.
Mm.
Yes.
Book your screenings, book your mammograms, make
Mhm.
that your Christmas, your birthday, make it your present to do that and help someone else do the same.
Yes.
Help someone else do the same.
Yes.
Family, today we, in honor of Breast Cancer Awareness Month and your life on a regular, ongoing basis, we've talked about the community work groups through the Medical College of Wisconsin Community Cancer Science Network, led by many people. Dr. Melinda Stolley
Mhm.
is the PI, the primary investigator, principal investigator for the project, along with several others, including Dr. Stacy Young, but most importantly, our community partner in this project for the Community Work Group of Milwaukee is Progressive Community Health Center. Family, we appreciate you being with us today. I thank my guests for coming today.
Thank
Thank
you for
you.
having
And
us.
yes, and you will see them again.
Oh, we will.
We will see you.
Okay.
Yeah, you all are coming back.
Yeah,
Y'all are coming back. There's
yeah, because
so
this has
much.
been awesome. And what I'd like for the guests to know, Progressive, 35th and Lisbon, 3522 West Lisbon. We would love to have you as our family. We are invested in your health. And we want you to be that as well. So if you don't have a family or primary doctor, please come check us out.
Yes.
We have dentistry, the whole 9 yards. So we'd love
Podiatry,
to
OBGYN. We have
yes,
Urgent
everything.
care.
Yeah,
urgent care. Yes. So we'd love to invite you into our family. So welcome
Awesome.
all.
Well, we thank Progressive for being here today. Family, we thank you for joining us today. We'll see you in 2 weeks. The first and third Friday is when we talk about your health and you. Thank you so much, Milwaukee. We'll be back.